example.
We as Uganda Ministry of Health, the Emergency Operations Center particularly, we have really benefited from Africa CDC's efforts in event-based surveillance, giving us the framework and training us. Before 2022, Uganda was conducting event-based surveillance activities very well, but with the little knowledge that we had, we did not have any training.
May we all take our seats as we are about to start. Thank you. Please be seated as we start. Thank you. Your Excellency, Dr. Jean Kassia, Director General of the Africa Centers for Disease Control and Prevention, Africa CDC, Dr. Ahmed Ogwal Uma, Acting Deputy Director General, and all the leadership of Africa CDC present here, public health experts and practitioners, representatives of the AU, UN, and development partners, members of the diplomatic corps, members of the press, distinguished delegates. Ladies and gentlemen, my name is Sarvesh Lachuman from the AUC Office of Protocol, and it is my great honor and pleasure to welcome you all to the One Health approach to the rising climate-related health threats in Africa workshop, which is being held today, the 6th of September 2023, here at the KICC in the beautiful green city of Nairobi, the Republic of Kenya, on the margins of the first Africa Climate Summit. Today's event has brought together policymakers, experts, and researchers, among other stakeholders, to discuss on the critical challenges climate change poses on infectious diseases in the African context, and to explore the climate change and public health nexus in Africa. Ladies and gentlemen, allow me to take you through the program of today's event. We shall have an opening statement by His Excellency Dr. Jean Kassia, Director General of the Africa CDC, followed by a keynote address by Professor Samuel Kairuki. We shall then proceed for high-level recommendations from technical discussions, followed by a fire chat on advocacy, and finally, we will have our closing session. Ladies and gentlemen, without any further ado, it is now my distinct pleasure and honor to invite His Excellency Dr. Jean Kassia, Director General of the Africa CDC, the boss of Public Health in Africa, for his opening statement. Welcome, Director General.
Good afternoon, colleagues. I missed you yesterday. I'm so happy to be with all of you today. We were expecting some VVVIPs, but as you know, We are running late with the event today, and I had the opportunity to talk with President Ruto immediately after the meeting. He told me that he's with us. For your information, it's President Ruto who wanted to see how we could organize this side event when I met him, I think, almost 1 month ago, to see how we are bringing health sector on the margins of the climate change summit. Then he shared with me he really wants to see how Africa CDC and all partners we take this agenda further, and we discussed that during the COP28, and we have his full support acting as champion for climate change in Africa. With this few words from our President Ruto, and also let me share with you what is the good news. Today we received the official communication from government of Kenya providing a nice building to Africa CDC that will become our HQ for the Regional Coordination Center in Eastern Africa. This is something amazing. It's showing that African leaders can take seriously the agenda of health in Africa, and also they consider the fact that if they start to invest in their health sector, we can attract more respect and also more support from others. Let me then come back to the statement that was prepared, because this is an official event. I want to welcome all of you to the side event to the Africa Climate Summit, an event which we have created to act upon the impact of climate change on our health. Our continent is facing multiple crises, from pandemics and diseases to global warming, floods, drought, and cyclones. Crises related to wars and unrest, whether in Africa or other regions of our planet, crises related to the economy, inflation, high interest rate, and high cost of borrowing. Sadly, the list is too long to enumerate. Together, these crises create the conditions for a perfect storm. As we acknowledge the urgent connection between health and our changing climate, we know that we will not have healthy people if we do not have a healthy planet. Together, we need to stand up, because this crisis it's also an imperative of being equipped to confront the unforeseen. Just a few years ago, who among us would have imagined the devastation caused by COVID-19 and the repeated drought that affected our continent? So, now that we know that, this is time for us to act for our future. Climate change and some diseases that are related to climate change, like cholera, Ebola, measles, polio, monkeypox. And yesterday I was talking with Richard, who's leading Sept, about Lassa fever that we see in some African countries, are linked to the climate change and are causing a number of deaths in our continent. So now, more than ever, it's time to brace ourselves for future health crises. Climate change and the resurgence of diseases like cholera, Ebola, and all others will continue to make a lot of pressure to our health system and economy. The impact of climate change on our health across continent is well known. More frequent and severe natural disasters, such floods, drought, hurricanes affect lives and livelihood of our people. Warming temperatures can lead to the proliferation of mosquitoes and other vectors that carry diseases such as malaria, dengue, and Zika. Climate change can also affect the availability and quality of water, leading to an increased risk of waterborne diseases such as cholera and typhoid. All of us, we know what cholera did in our Southern African countries, with almost 15 countries affected in Southern Africa, Central Africa, and some of them in Eastern Africa. And in many parts of the continent, it is impacting agriculture, production, and food security, which in turn affect nutrition and public health. Therefore, we have no choice but to forge a resolute, anticipatory, and united front against health threats and mitigate and adapt the impact of climate change in our life. This will request a very strong commitment, a cross-sectoral and an harmonized approach. Africa CDC, as a specialized technical institution of the African Union, is establishing the support to public health initiative of our member state. And we are strengthening the capacity of the public health institutions to detect, prevent, control, and respond quickly and effectively to diseases and other related climate change threats. The necessity for preparedness and adaptation in Africa cannot be forgotten. Equally, the necessity of collaboration and embracing a common agenda cannot be exaggerated. Many African nations are still facing weak health systems, including strained healthcare facilities, the weakness of the health workers in terms of quality and quantity, and inadequate surveillance system. Historically, these deficiencies have affected the ability to respond robustly to health challenges, resulting in preventable fatalities and long-term setbacks to the development of our nations. Climate change has made conditions worse, displacing populations, ravaging crops or livestock, and denying people of proper nourishment. Yet, as Africa confronted the onset of the COVID-19 pandemic, our resilience emerged as a beacon of hope. In the spirit of unity, collaboration, and perseverance that guides Africa CDC work in addressing climate change as a public health issue of the continent, we believe that our effort to mitigate the impact of climate change in Africa will include working with member states and partners to build resilience and adaptive capacities at the individual, community, and national levels. We all support African-led research and innovation, which will help us to better understand the health impact of climate change on the continent and develop effective strategies to mitigate and adapt to its effect. In order to drive home the urgent need for action, we advocate for increased awareness of health impact of climate change. We also advocate for more funding for resilient health system. So, we stand at a pivotal juncture to bolster our readiness for the next pandemic. That is an opportunity to build strong and resilient health systems under the new public health order that is the blueprint for action, guiding Africa CDC action, and supporting the public health systems and health security across our continent. Additionally, the initiative known as the New Deal ensures that Africa CDC functions as an effective, transparent, and dependable institution that is coordinating preparedness and response to enable nations to tackle a spectrum of health threats with efficacy, cultivating a skilled workforce and crafting surveillance systems that can identify an area of diseases. To ensure that we fulfill our important mission together with our partners here represented, we are drafting a comprehensive plan that also incorporates the effect of climate change. Firstly, we are supporting countries to develop pandemic preparedness plans. The trajectory of the COVID-19 pandemic revealed that African countries with well-laid preparedness and response plans were more successful in managing the virus compared to other countries in other continents. Comprehensive, regularly tested preparedness and response plans are pivotal for nations to manage imminent health and climate emergencies. These plans must encompass diverse domains, including early detection, rapid response mechanisms, risk communication strategies, data management systems, and approaches to mobilize resources. Africa CDC stands as a pillar of support in fostering the development, validation, and execution of these plans to ensure swift and unified response to emerging diseases. Secondly, the allocation of resources emerges as an imperative. I was discussing with some head of state immediately after the meeting. They were asking me, how much do you need? I say, no. How much do we need in Africa to build strong and resilient systems? This is the narrative that we need to change. And I was talking for our head of state. I was telling them, I didn't see strongly recommendation on health area on what we are reading as action for climate change in Nairobi. But what they told me, we are there. Everything is led by health sector. And I'm convinced that what we are doing together today will continue to fuel the discussion that we have on the climate change and links to health sector. Directing resources toward African-led research will yield solutions that are sustainable and conceptually pertinent to our regional health challenges. Historically, global health systems and resources have been distributed, often leaving African nations more disadvantaged and limited access to international aid during health crises. By fostering homegrown solutions, we are advancing the autonomy of Africa, and we are pushing the agenda of equity in this world. Thirdly, the strengthening of regional collaboration emerges as a backbone of preparedness. African nations must come together to exchange insight and experiences, share resources, and disseminate best practices in pandemic preparedness and response. Tropical cyclones and the COVID-19 pandemic are a reminder that the weather or viruses do not care about our borders. That is why our collective health security must lead the agenda in Africa with more collaboration and more coordination. Regionally, assemblies provide vital opportunities to convene African leaders and partners, fortifying collaboration and innovation to foster more resilient healthcare systems. That is why Africa CDC is proud to host this event on the sidelines of the historic Africa Climate Summit, as well as the upcoming Third International Conference on Public Health in Africa, CPHIA, that will take place in Zambia in November 2023. Today, Africa finds itself at a crossroad demanding proactive measures to safeguard the well-being of our citizens and construct and build resilience of our people against future health threats. The lessons from the climate and COVID-19 crisis has given us an opportunity to come together and to build a strong PPPPR. It means Pandemic Preparedness, Prevention and Response Plan. The time has come for our government across the continent to formulate comprehensive preparedness strategies, allocate resources including investment in health infrastructures, workforce, research, and innovation, and to extend cooperation beyond borders and institutions to fortify collective response. Through these concert actions, African nations can effectively navigate climate and health crises, curbing. Let me welcome my sister, Commissioner Josepha. Let us applaud for Commissioner Josepha. She's leading the environment in AU. And Commissioner, you have a message from Commissioner Minata, who's sick. She's affected by climate change related issue, dengue, and she's resting. She told me, you have to talk about climate change because I'm one of the victims of the climate change. I was saying, through these concerted actions, African nations can effectively navigate climate and health crises, curbing their impact on communities and economies alike, ultimately steering our continent toward a healthier, more resilient and prosperous future. There will be no healthy planet without healthy people, and no healthy people without a healthy planet, and no one will be secured if Africa is not secured. For your support to this event, for the message that we are giving to our communities, for the advocacy that we are conducting to our leaders, we believe that Africa can be well prepared for the next pandemic that will more surely be a zoonotic pandemic worsened by climate change. We believe that this meeting today will bring more attention on health-related climate change issue. I thank you.
Thank you, Your Excellency, Director General, for that statement. We are sure that your leadership and guidance will take the continent's public health agenda to greater heights with the great work of the Africa CDC, African Union's Public Health Agency. Ladies and gentlemen, before we continue, allow me to recognize the presence of Her Excellency Ambassador Josepha Sako, AU Commissioner for Agriculture, Rural Development, Blue Economy, and Sustainable Development. May I now invite Professor Samuel Kariuki, the Eastern Africa Director of D&DI, for his keynote address. Professor Kariuki, over to you. Thank you.
Your Excellencies, distinguished guests, ladies and gentlemen. Very, very pleased to be here. And thank you very much to especially the leadership of Africa CDC for the invitation to be able to come here and share our thoughts about what DNDi and the world that deals with neglected diseases is doing about climate-sensitive infectious diseases, and especially because of the issue of antimicrobial resistance as well. What I want to do is to take you through a couple of slides just to share with you some of the emerging issues on climate-sensitive diseases, but also look at how together we can approach this issue and look for solutions. How can we respond to what we're already seeing as an African continent? I hope somebody will be changing the slides to the next one. We're already very, very familiar with the fact that sub-Saharan Africa has contributed the very least in terms of the global warming, but we experience the most devastating effect of climate-sensitive diseases. Why? Because most of the diseases, most of the vectors that transmit diseases are within the tropics. And despite the global spread of these diseases, especially in countries in the north, we still continue to bear the huge burden because we have a lot of diseases here. The poor, young, and those that have pre-existing conditions, those that have underlying conditions, very poor immunity due to maybe nutrition and so forth, are the most vulnerable in our society, and we must do something about that. Next slide, please. In the last 5 years, you just need to look at these maps from WHO data to be able to see how much can change within such a short time. That within a very, very short time, you're looking at a map in 2017 and now a map in 2023, where we now have a huge burden of disease that are spread continent-wide because of changes in weather patterns, encouraging vectors of disease and other environmental disasters that keep climate-sensitive diseases at a very, very high level in terms of incidence. Next slide. Now, if we look at particularly the diseases that we call neglected, and I'm particularly concerned about the language here because these occur mainly in neglected populations in most of our countries. You find that there's been increased disease transmission, mainly due to the fact that we have favorable conditions for those diseases to spread in our environment. We have a range that has expanded. We find new areas where tropical diseases now are causing global outbreaks. We just heard about His Excellency Dr. Kaseya mentioned about emerging issues such as dengue fever appearing in places like US. We've heard about the emergence in Japan. We've heard about Ebola cases. We also look at the issues regarding increased resistance to treatment. And AMR, antimicrobial resistance, is one of the disasters waiting to happen. We call it a silent pandemic, but we're already seeing the effects already in hospitals and in our communities. We see also the issue of the risk of elevated epidemics. And we can look back at some of the epidemics we already dealt with. Ebola, we dealt with, of course, COVID-19 in the last 3 years or so. And, of course, climate change is also to blame for increased migration effects, disrupting livelihoods, leading to people getting to areas that were previously not occupied, and of course, that disturbs the ecosystem, and hence, of course, coming into interaction with new infections. Compounding health inequities, again, a big, big issue that has been brought about by climate change in our midst. And we have seen that with regard to rising debts for countries in Africa. We have seen it with regard to increased poverty rates and severity of disease. Again, this mainly brought about by new vectors emerging and occupying areas that we didn't have, and therefore, of course, increased transmission of diseases. Next slide, please. I'll give you a few examples just to illustrate this, and then we'll look for solutions together, how we can respond to this. Early this year, Kenya Medical Research Institute, with other partners that work on malaria vectors, discovered that one of the vectors, Anopheles stephani, had invaded our country here. Of course, hitherto, other countries that had also discovered this new vector of urban malaria transmission were Djibouti, Ethiopia, Sudan, Somalia, and Nigeria. As we speak, this is one of the new vectors that 5 years ago we knew only existed in Southeast Asia. Now it's here. It's going to increase the rates of transmission of malaria in urban settings. So that's a danger in itself, brought about by the fact that this new vector is able to establish itself here and be able to thrive much more than before, and therefore, of course, spread urban malaria. Next slide, please. Let's also look at this other example of Rift Valley fever. As you know, this also has been endemic, especially in our regions here. If you look at the cycles of epidemics due to Rift Valley fever, and some of them are very recent, 2021, 2022, we reported a few cases in the northern part of Kenya. Most of these outbreaks have been cyclic, associated right from 1997 when we had a huge outbreak in the country due to El Nino effects and then followed by El Nino effects. And we see, of course, the fact that these epidemics, of course, emerges from one region and quickly spreads to another region, courtesy of the flow of vectors that transmit this disease. These vectors are always encouraged to be able to transmit these diseases from one region to another because of the weather changes, the patterns of climate that are changing to be able to effectively encourage these vectors to survive and spread these diseases. And now, as we speak, we have, of course, adequate data from meteorological department to be able to utilize, to be able to know what we are likely to predict in the next 5 years in terms of Rift Valley fever outbreaks, and then get prepared about it. What are we doing about vaccines, for example, to prevent both livestock and humans? What are we doing about moving certain vulnerable populations from areas that we know for sure are hotspots of this disease? Next slide, please. Dengue, again, while I was in school, and much later on, about 10 years ago, I would have sworn that we don't have dengue in Kenya. Maybe a few cases imported due to travel along the coastlines. Right now, as we speak, dengue is one of the most prevalent mosquito-borne viral diseases globally. In 2019, WHO designated it as one of the top important diseases that we must deal with. Right now, since 1999 to 2019, you can see the very huge increase in incidence of dengue fever. This is unprecedented. Within a very, very short time, a period of 10 years, you find 85% increase in incidence, largely due to the fact that we have global rising temperatures encouraging the breeding grounds and expansion of breeding grounds of the vectors for dengue fever. And the global impact is going to be much more. Of course, we expect that by 2080, unless we do something and respond to this pandemic, more than 60% of the global population are going to be exposed to this disease. And know the devastating effects. We, of course, working at DNDi and other partners to look for vaccines, to look for treatment. But that's not enough. We must respond faster to do something we call prevention and control before we actually think about treating. Unfortunately, as we know, most of these diseases, if they don't occur in the north, then sometimes the response is slow. It's up to us here in Africa to take matters into our own hands and respond as quickly as possible to be able to have these diseases brought under control. Next, please. Leishmaniasis is another disease, again, affecting mainly marginalized populations, people who are poor and easily forgotten. Up to now, 600 million people are at risk of, especially the very, very severe form we call visceral leishmaniasis. And we look at this disease as devastating because people have become impoverished. They are no longer able to be productive in their work or in their families. And this is something we must be able to come into effect in terms of control and prevention. And again, looking even at the local epidemiology of this particular disease, less than 2 months ago, we started reporting cases in a place called Kajiado. And that is new. That is unprecedented. We never had cases in Masailand. Now we're reporting cases. Again, this is an issue of climate change that is encouraging the breeding of vectors of leishmaniasis. Another example, next slide, please. Sleeping sickness, we were on the verge of actually being able to eliminate this disease, but again, the rise in mean temperatures and weather conditions, again, shifting the main vector to the species that we call Trypanosoma rhodesiense. And that is a strain that is fairly new in our region and very, very efficient in transmission of sleeping sickness. We want to be sure that by 2090, that we are able to save populations of this disease and be able to progress our elimination plan so that we are able to make sure that we afford treatment in a manner that is being able to control this disease before it spreads further than that. Next slide, please. Let me come to another pet subject that we've worked very, very closely with Cambry to be able to understand, and especially the cyclic nature of cholera. And I'll give examples of what we've been able to do over the last 10 years or so. We've had major outbreaks in this country. Again, when you look at the years when we had major outbreaks in the 80s, in the 90s, and now in the year 2000s, these cycles coincide with major climatic changes. Some of them El Nino, some of them actually during the dry season. And this is confounding people, even scientists, because naturally we sometimes attribute cholera outbreaks to only flooding. But now you find cholera outbreaks even when there's a dry season. And that we must take into cognizance, knowing that these are unusual epidemiologies of diseases brought about by climate change and adaptation of these bacteria to be able to survive in these conditions over time and spread more. We saw, for example, in this article that I contributed early in the year, the conversation, why cholera continues to threaten many African countries. That sometimes we give very, very piecemeal attention to cholera outbreaks in the countries. We don't really perceive that unless we are able to nip these outbreaks at the very, very beginning of the outbreaks, we are likely to lose control of these outbreaks. And very, very important that whenever a case is reported, public health measures are come into effect very, very quickly and control infections before they spread. We saw, for example, during COVID, we reported fewer cases of cholera in our cities, in our areas where we have hotspots, than we are doing now. And we see this associated especially with laxity in water, hygiene, and sanitation issues that were there during COVID. So we must again bear in mind that some of the very, very basic public health measures that control diarrheal diseases, of course, control many other diseases, including respiratory infections. So we must be able to build this awareness among our communities for them to take matters into their own hands, right from the homes to schools to colleges and elsewhere, be able to effectively manage affairs in this way by instituting very, very simple means of prevention and control. Next slide, please. Now, I've given you a story about Kenya, but the rest of the continent is not different. Right now, as we speak, as you heard the director of Africa CDC mention, at least 24 countries now are reporting cholera as we speak. Now, fortunately, of course, many of them now have instituted OCV, oral cholera vaccine, for prevention and control. But it just tells you that in a very, very short time, this disease spreads to so many countries, simply because probably at the beginning we didn't take enough measures to be able to prevent and control spread of this disease. And I'm happy Africa CDC is taking leadership in building awareness, but also building resilience and preparedness for effective control of cholera and other epidemics. But this picture tells you that case fatalities can be very, very high if cholera is not controlled properly. 2.9% in Africa. Globally, average is about 1.9, but in Africa, case fatality rates can be extremely high. And again, most affected populations are the ones that are in poor informal settlements or the slums, and also some of these very, very young children and old people. Next slide, please. Now, in our work with the Kenya Medical Research Institute and the DNDi, what we've done is in some of these hotspots, we've gone back there to try and understand among the pathways that exist as risk factors for transmission of cholera, what is the most important? What can we tell policymakers that if you intervene in this pathway, you're likely to control cholera in the short term and medium term? And what we did here is that we looked at a total of 14 different pathways using a method we call sanitation pathway assessment, a method that's been developed with colleagues from Emory University. And what we found out is that open drains contributed the most, especially in hotspots in informal settlements. Second was water, municipal water. It comes in well chlorinated, and then families fetch the water, take it to their homes. But because this water is stored in containers, open containers, when they're using this water, children and everybody else is, of course, going to use the water and the fetching with cups and other containers. That's where contamination happens. And that becomes the second most important source of transmission within the household and then goes to the communities. And I'm happy, myself and my team contributed to the call for vaccines for intervention in some of these vulnerable populations. And the Ministry of Health, together with UNICEF, right from around January this year to around May, were able to give 2 million doses of OCV and be able to provide these life-saving vaccines to the population. I'm happy that is happening. We must continue to be able to prevent these diseases as we find them. Next slide, please. Now, the biggest problem with cholera, as we know it now, is the emergence of what we call multi-drug resistance strains of Vibrio cholera. We didn't see this 10 years ago. This is again new and unprecedented. The Vibrio cholera we're finding now is resistant to most of the commonly available drugs. Again, totally different from what we perceived 10 years ago. And we started seeing this new strain of Vibrio cholera around the year 2012, and this was strains from the refugee camps in the north of this country. And then this spread towards the cities, and now as we speak, since 2015, we're finding that nearly 85% of strains causing cholera are drug resistant, multi-drug resistant. And that drug resistance, for those that are not scientists, is spread on something called a mobile genetic element. It's a large element, as you can see, nearly 169 kilobase pairs in size, and carrying with it a lot of resistance genes. And these exchange within themselves, within the environment in which they live. So you find that it's not just cholera. They speak with each other, with E. coli, with Klebsiella, and they exchange these genetic materials. So we must be wary of this. How can we control both epidemics in terms of disease, but also antimicrobial resistance as a phenomenon? Next slide, please. Now, speaking of drug resistance, we are not out of the woods yet, because this is a strain that we call non-typhoidal salmonella that causes very severe invasive disease in young children less than 5 years of age. And what we're finding is that now we have new strains that we are working with colleagues in the DRC Congo, where now the bacteria are resistant to more than just the normal or the regular drugs we use, but in addition to the two last drugs of resort. We call them the fluoroquinolones and the ceftriaxones, which are the third generation cephalosporins. And we're finding that the pan-drug resistant strains now are spreading wide. We now find a few of the strains in Burkina Faso and other places. Again, on large mobile genetic elements. Next slide, please. Now, next slide, please. I've just mentioned about climate change and antimicrobial resistance. And next slide, please. And the antimicrobial resistance crisis in infectious diseases has been, over the years, known as a silent pandemic because it doesn't show very well. I have been asked several times by media, We have seen TB cases. We've been shown malaria cases. Can you show me somebody with AMR or with antimicrobial resistance? Of course, it shows you how often we cannot be able to explain antimicrobial resistance. Now, Paul Ehrlich, who discovered ehrlichiosis as a disease, gave this statement that drug resistance follows the drug like a faithful shadow. Whether we use the drug in the right manner or misuse it, resistance will happen. But what we must know as physicians, as public health officials, as lay public, is that there are ways to be able to delay that resistance by utilizing antibiotics in a proper way. Next, please. Now, this to me is a very, very important message for public health, that if we compare the effects of antimicrobial resistance by 2050, that each year we lose nearly 1.3 million people from drug-resistant infections. 1 in 5 of these deaths are in young children, the future of our generation. In Africa alone, you've seen this from the already report, the WHO report, which is available, that we are likely to lose 4.15 million people every year by 2050. Next slide, please. The effects of AMR. So if we look at this crisis, and therefore, of course, the need for One Health approach for solutions, to put it into perspective, in 2021, COVID-19 caused nearly 3.6 million deaths globally. But in 2019, the report that we have that was commissioned by the Lancet gave a figure of nearly 5 million deaths associated with drug-resistant infections. So you can see that this is really very, very unprecedented. Next slide, please. So how can we respond then to climate-sensitive infections? Next slide, please. We have to be able to change the way we look at drug-resistant infections, but also climate-sensitive diseases. We must be able to afford ourselves the knowledge about what is changing, what is new in neglected diseases. What are the new emerging diseases, some of which are mainly zoonotic in nature, nearly 70% of them. Migration that is due to climate change. How then can we be able to respond to that? We must look at the looming crisis in innovation and access to treatment and means of prevention and control, especially vaccines. Next slide, please. I'm nearly winding up. So it's very, very crucial that we must adopt the One Health approach to responding to climate-sensitive diseases, because more than 3/4 of these diseases that are emerging are actually zoonotic, spread between humans and animals. We must expand our collaboration to be able to do this, and no one entity can be able to deal with this. We must act together. We need to strengthen surveillance and response systems, and I'm happy Africa CDC is partnering with countries to do this. And then new tools, including drugs, diagnostics, and vaccines, to be able to detect these diseases as they happen, and also be able to prevent using vaccines. Build resilience and adaptability in communities. The communities sometimes are very resilient in the way they can handle antibiotic resistance and also emerging infectious diseases. Next, please. So at the Drugs for Neglected Disease Initiative, we think that we need to develop new treatments. We must go green in our R&D and manufacturing to be able to sustain our environment, and then also champion for access for climate-sensitive diseases, some of which really occur only within the tropics, and therefore the north countries that are rich with pharmaceutical industries may not be interested. We must take this within our own hands to be able to deal with them. I think next slide should be almost the last one, where I want to deal with issues of combating antimicrobial disease. And I've put a number of thoughts that are very, very crucial. And this is, for example, we must then deal with One Health approaches to antimicrobial resistance, both in livestock and in agriculture, because the same molecules are used in both places. Diagnostic stewardship and AMR stewardship, again, we must increase this. Infection prevention and control, something that we can use to reduce the burden of disease in communities, we must adopt that. And then, of course, long forgotten is the environmental impact of antimicrobial resistance. We must be able to know what's happening within our environment in terms of sustaining both infectious diseases but also antimicrobial resistance genes. Vaccines, I've already discussed about vaccines, the need to prevent disease before they happen so that the burden of disease is reduced. And then, of course, regulatory affairs within governments must be strengthened so that we don't have poor quality antibiotics coming through all forms of importations that are unlicensed, and then impact of AMR for policy action. I can tell you that most of our policymakers understand figures. So let's tell them what the impact will be if we are dealing with antibiotic resistant diseases that make patients stay more than they would have stayed in hospital. Let's have those figures working together with the economists to be able to provide that for impetus of action. Next slide, please. So finally, just to acknowledge all the contributors of this data, and hopefully this spurs us to be able to discuss how effectively we can be able to face and respond to climate-sensitive diseases and antimicrobial resistance. Thank you.
Thank you, Professor Samuel KICC, for your address and a very insightful presentation highlighting the nexus on climate change and public health in Africa. Ladies and gentlemen, it is now my pleasure to invite to the podium Her Excellency Ambassador Joseph Asako, AU Commissioner, His Excellency Dr. Jean Kassia, Director General of Africa CDC, Dr. Ahmed Ogwell Ouma, Acting Deputy Director General of Africa CDC, and Dr. Joy Katengwa, Senior Strategy Advisor on Africa at UNDP, for an official photo and the closing ceremony. Thank you. Before we take the seat, I'll request Silas to come for the official photo. Probably Professor Kariaku, could you join for the photo, please? This.
It's fine. No, I wanted him to post one.
Thank you, Excellencies. Ladies and gentlemen, it is now my pleasure to invite Dr. Ahmed Ogwell Ouma, Acting Deputy Director General of Africa CDC, for the high-level recommendation from technical discussions.
In the interest of time, Excellencies, I'll stand on the protocol that has already been established and to share with the session today that yesterday we had a whole day session where we discussed at length the nexus between climate change and health. And we use the context of the One Health approach to have that discussion. I have a series of slides, but in the interest of time, we'll keep it very short and focus really on the key recommendations that came out of each and every of those sessions that we had the whole day yesterday. Let me begin by quoting the Honorable Minister of Health of Malawi, who at the beginning of the summit said, and absolutely correctly, that the face of climate change is health. So when we are talking about the differences in, the changes rather in the climate situation globally, what we see most clearly is the health effects that it has on the populations around the world, particularly here in Africa. So with that in mind, then I'll quickly go through these slides. Next slide. We had 3 panel discussions and 1 fireside chat yesterday. And these 3 had different objectives. The first was really to look at the interconnections between climate change, the environment, the current landscape, etc. The second panel focused on early warning systems. And the third one was looking at holistic frameworks, particularly policy frameworks, that could be able to respond to the challenges we are facing with climate change. So bear those 3 in mind: the interconnections, the early warning systems, and the holistic approach. Next slide. I'll skip this slide to the next one because I want to focus only on the recommendations. Now, when we look at the interconnected nature of the different sectors that we were discussing yesterday, and that is human health, animal health, environment, and to some extent finance as well, there are gaps, and we discussed many gaps, but these are some of the key recommendations that we need to address going forward. One is the need for leadership and governance. We have a lot of knowledge within each sector, but when those sectors are brought together, that governance mechanism is still relatively weak. The One Health governance mechanism globally is still relatively weak. So we need a health in all policy approach so that we can bring together all the different sectors to work on the different mitigation strategies. I will focus on the second one, which is financing. That although within the climate discussions we have different platforms where resources are available, trying to get those resources to address health issues has become not only difficult, in the words of ministers 2 days ago, it has become impossible. As they said, it's like going to heaven. The road is very narrow, the door is very small. You definitely can't be able to reach those platforms for financing within the climate agenda. Next slide, please. Now, picking the second one, which is on largely early warning systems, and I'll focus only on recommendations. Next slide. We see that there is need for a carefully designed multi-sectoral approach. The data that comes from animal health, the data that comes from human health, the data that comes from the environment side of our work, the data that comes from the financing side need all to come together. If we bring them together, then we'll have a much better perspective on the problem and therefore an easier innovation for solutions that we need. But as we do that, we need to go to the community level. Climate literacy at the community level is key because these problems start at the community, they are observed at the community, and the solutions come at the community level. So we need to ensure that climate literacy, knowing that these problems are coming as a result of climate change, will be at the community level, and when we get resources to address the issues, then again we go back to the community. That is currently a gap. Next slide. And the next one, as we focus on holistic climate strategies. So when we look at these policy frameworks that are there, we have very good strategies individually in each and every sector. As Professor Kariuki has shown us here, they are doing wonderful work at the science level within human health. But then when you try to connect that with financing, there's very little that is happening in that space. When we try to connect that with human health Again, there is work, but it's not a lot, meaning that we need to ensure that all these policy frameworks that are very good in the individual space are brought together. We were challenged as Africa CDC to play that part. It is our mandate, and we committed as we go on expanding our work in this area that we are going to do exactly that, to bring together all the sectors to ensure that human health is secured in an effective way. Next slide. Now, next slide, please. We also had a discussion around advocacy. And we were honored to have a senior representative from the Africa Development Bank who shared the possibilities of how we can access resources from the Africa Development Bank. Indeed, they have invited us at their next meeting to hold a session on climate health nexus so that their constituencies can be able to hear from us as Africa CDC. Now, when we explore all the financing models that are available and we look at the possibilities of accessing these finance models, it is very clear that health is at the back of the queue. Right now, if you look at the declaration, food security rather, has made it to the table, and it is being discussed. Our next agenda, and I'm glad Commissioner is here, is to bring health as well onto that agenda. So when we discussed how we can be able to access some of these resources, we did discuss and agree that all the relevant platforms, including COP28 and going further, the other COPs that will come, we need to bring health as a concrete agenda item onto this discussion. Final slide. So in summary, Excellencies, the discussions that we had yesterday were heavily scientific, with a lot of advocacy, but they need to be translated into action that you and me, from whichever sector we come from, can be able to direct so that human health is not only secured, but our environment comes along with that security of health that has been our focus so far, but we need to bring all the other sectors into the discussion. We are convinced that if we do this together, then we are going to have a different discussion in future Africa Climate Summits, in future COPs. Indeed, we are going to have different results at the community level, which are going to be positive for the African to be able to enjoy their health despite the climate changes. Thank you.
Thank you very much, Dr. Ahmed, for this very short presentation on the high-level recommendations. May I now invite Dr. Joy for a very short intervention on advocacy before we proceed to the closing remarks by our Excellencies. Dr. Joy.
Thank you very much. Good afternoon to you all. My name is Joy, and I'm here representing the Assistant Secretary General and Director of the UNDP Regional Bureau for Africa. All of the protocols observed. Prof, let me say it was a pleasure to listen to you. I have a few messages to share from ASJ's Yakonwa, talking really about advocacy, but also trying to add something else to this nexus, because we spoke about climate, we spoke about health, but we must link it to development as well. And so in this context, sharing a few examples from UNDP. And here we think about the COVID-19 pandemic and how recent it is in the minds of all of us, and really bringing the message that we must take lessons from there. One of the key lessons from the pandemic was the need to build trust in health systems. And what we did with the Africa CDC on that occasion was work with the ACDC, but also with the private sector to develop what you now know as PANABIOS, which brought trust into the travel system and allowed Africa to reopen. I think One Health will also need very much this question around integration. In UNDP's experience, integration is critical. And so integrating means bringing all of the aspects together. At UNDP, we have experience with integrating HIV, non-communicable diseases, gender equity, environmental impact assessments. And so thinking about the experience on integration and starting ab initio with that mindset is critical. The other point to raise here is the idea of putting the last person first in One Health. Prof spoke about ensuring that we don't leave anyone behind, I think is where he was going. And so we can do this by targeting outbreaks at their source through rural communities who depend on nature for their subsistence. The One Health approach will also require mitigating by building capacities and resilience of communities. Now, you obviously are the experts. You know we need to do vulnerability assessments, prevention plans, and so on and so forth. The final thing I'd like to say, in the interest of time, given 2 minutes, is really to talk about the idea of introducing the power of digital in helping the One Health approach to find and attain its objectives. So UNDP, in our 1.4 billion COVID-19 response, helped 86 countries to adopt digital technologies for COVID-19, for the vaccine delivery and for strengthening systems for health. And we think that there is something of this that can come to bear. I didn't make a point about the fund, but a fund is critical. The idea that you have aspirations as to the nexus has often failed when we think of a comparator in terms of humanitarian development and peace, because we go to mobilize resources individually and in silos. And so thinking about how to bring this all together with a fund that pushes it ahead is something to think about. Thank you very much.
Thank you, Dr. Joy, for your address, especially on your focus on advocacy and the triple nexus on climate, health, and development. Ladies and gentlemen, may I now invite His Excellency Dr. Jean Cassier, Director General of Africa CDC, for his closing remarks. Over to you, DG.
Colleagues, please allow me to break the protocol. There is a wonderful person here. We are all in Nairobi because Her Excellency Commissioner Josepha, who's leading this area of environment in AU Commission, did everything to make this event a success story. I will not conclude without giving an opportunity to say a few words about this event, the side event that we are organizing. And because after that, we'll continue to work together to push this agenda, please.
Good afternoon, every one of you. Thank you, my dear brother, Dr. Jean Kassaye, Director General of CDC Africa. I would like also to recognize, I don't know, Excellencies, if there are ministers present here. Let me recognize the presence of my sister Mani, my brother, and all the colleagues, the representative of the development partners, our international development partners, civil society, I believe the organization they are here, our collaborators, dear colleagues, ladies and gentlemen, all protocol observed. On behalf of the African Union Commission and on my own behalf, I wish to sincerely welcome you all to this closing session of the One Health Solution for climate-related health challenges in Africa. Let me extend a word of gratitude to all the partners that have worked hard at organizing this session, especially our colleagues of Africa CDC. Climate change is not a one-man's business. Environmental agenda is not one-man's business. It involves all of us. Climate change or environment, they are cross-cutting issues. They are nexus. So that is why when you see my department that has really the mandate of sustainable environment, when we talk of environment, we touch everything, disaster risk reduction, meteorology, we are everywhere in this ecosystem of climate change, disaster risk reduction, all the thematic that we go through, meteorology, so soil, we talk about water, sanitation, all these are linked. We even talk about today, food security, stunting for children, all these are related with the impact of climate change. So that is why I really welcome this initiative in our inaugural African Climate Summit, that we, all of us, all the sector, should start identifying what is really the impact of this climate change, sector by sector, according to our skills. At the African Union, we have 6 departments. All these 6 departments, we are all interlinked in terms of, these issues of climate change. I'm not silo, and I don't want anybody to be silo, because it affects everybody. It affects everybody, because once there is like a drought, all the region is transboundary area. Like if you look at the southern part of Africa, we are suffering from drought. Here at the Horn of Africa, East Africa, they're suffering. It's not just one country. It is about all of us. This calls for us to work together, coordinate together, and go and speak one voice when we are in this agenda of climate change. We usually go to COP. There's a lot of side events. This platform is very nice because it gives us knowledge changing, sharing. It gives us opportunity to showcase of what we're doing. It's very, very important, this type of gathering. But when we leave here, we have to bring concrete solutions, because otherwise it's becoming a tourism. I used to say it in COP, because we leave what we have to do, we organize ourselves, and we go to COP. When we go to COP, what is the outcome? It's picture. We are there, we take picture, family picture, nothing substantive that can change the suffering of our population in terms of all these departments. When you look at my department, which is agriculture, we are not bringing anything that can change the livelihood of this community. Africa has 70% of its population are rural. What's COP1, COP2, we are going to have in Dubai COP28? Are we going to have COP100, COP1000? None of us in this world will be here, in this room, in 1000. Maybe, so let us, the genesis of this inaugural African Climate Summit is the first, but it should not be the last. Because when we go there, we don't pollute, but we are the more vulnerable in these areas. And we cannot just, like President Ruto, let me quote him, we cannot be victim, because we have all the resources to take care of our destiny. Even in terms of all these diseases that are affected, that are coming due to climate change, we should not be looking elsewhere to solve our own problem. Charity begins at home. That is why it is very, very important that we take our agenda, really forward, and we should avoid discussing. This is a nice discussion. Whatever outcome that comes here, like my brother Dr. Jan, he said it rightly. After that, let us come with a concept, a strategy, and let us start working on that to tackle all this. So this department is just coordinating, but other departments, they have their own areas where climate change is affecting. If you look at infrastructure, they have their own problem. Today, if you look at space security, we have migrating, climate migrate. So everywhere, if you look at the health, all this malnutrition, this thing, it's a problem of health. They have to look at people that are sick. So I think with this, I know the time is really against me. Let me just read some areas that we really know. I will comment about this side event. This side event highlights the debate on the health approach to addressing climate-related health challenge in Africa as a major concern for health in Africa in the context of Agenda 2063, the Africa we all want. The climate crisis, combined with other concern about food, erosion of biodiversity, and spray of GMO food consumption. Doctor, we have to look at spray of GMO food consumption. This is a very big debate, but science is not, science depending what size the science is. If it is science where they want to get profit, they will say, no, we eat GMO, but it doesn't have any effect on health. But if you see science in terms of the communities, what is the impact? Our continent before, we used to be bio or agrosystem, agroecologic agricultural practice. We're not using fertilizers, we're not using these seeds, GMO seeds, and we were not having cancer, because I'm relating it all with this health. We are not having cancer the rate of cancer we are having today. And this cancer is mostly on what we eat and what, all these mutation that we are doing in our own health. So we have to be very, very careful with GMO food consumption. I will not eat GMO food consumption, because I know when I go to supermarket in Europe, all the shelves are bio. So if they are eating bio in the global north, why should we eat GMO? Because of our population is growing. This is another debate I don't want to get out of but it's one of because we're talking about food. And when you say GMO, is also one of the causes of disease in Africa. Raise question about the future of human health, which is suffering from its own heel. This crisis exposed the deep-rooted dysfunction of an unequal world and reveal Africa's unbearable vulnerability and the vagaries of climate, despite being the continent with a lower greenhouse gas emission. In Africa, climate change is raising a number of fundamental questions about the relationship between the climate and the quality of life of Africans. It demands a new vision of the world in which migration and mitigation and adaptation can only be relevant response if they are part of the genuine global cultural shifts. Indeed, our section as a commission is to steer the debate on climate resilience health strategy in Africa in the context of lessons learned from the recent management of the COVID-19 pandemic health crisis, which has a stark reminder of the vulnerability of the interconnectedness of the international system, where the Africa CDC once again demonstrated the potential for cooperation and shared solution for member states in the event of the pandemic. As I say in my introduction, the African continent is increasingly vulnerable to disruption caused by climate change. We know very well that African climate change increases the burden of many diseases, especially of our population. We saw it. In the interest of time, let me go to the conclusion, because I don't have, but we saw it. We had an opportunity to see with doctors, professors, that they are really, gave us very insightful, presentation. So this one we take good, it will help us in our own, governance in these issues of climate change. So to conclude, I would say in this context, we welcome the effort of African CDC to host this debate, as Africa is one of the most vulnerable continents due to its high exposure and low adaptive capacity. 2, improving the continent's climate resilience is key to unlock its development potential in public health, particularly through investment in research, monitoring, and surveillance of climate change and health, and increased funding. The previous speakers talked about funding for climate resilience health system. The African Union supports the emergence of initiative in Africa that can advance research on emerging and re-emerging diseases on the continent, with a cross-cutting focus on issues such as climate change, to help member states design effective public policy in line with the Agenda 2063, the sustainable and self-centered development perspective. A healthy climate is essential for a healthy environment and ultimately for the people of our continent. I thank you very much for your kind attention. Merci por votre atenção. Muitas gracias. Muito obrigada. Asante sana. Shukran.
Thank you, Excellency Commissioner. And may I now invite His Excellency Dr. Jean Cassia, Director General of Africa CDC, for his closing remarks and to officially close this side event. Thank you.
Thank you. All of you, you understand that Commissioner Josefa speaks 5 languages. And Commissioner, I don't forget that you commit to give me food, healthy food, when we are back in Addis. Thank you for coming. Thank you. I want to read, because after all of these discussions that we had, I just have few conclusions. But please let me first recognize the presence of all of us. I want to talk about the public sector. We have colleagues from ministries and from other divisions of the government here. We have also private sector. Dr. Amani, I don't know if Dr. Amani, as for if people, they know you. Maybe you can stand up, they must know you, because Dr. Amani is the voice of the private sector in Africa. She's leading the Africa Business Council. Take time to talk with her after the meeting. She knows everything. She knows so many things. And she's inspiring me every day. Thank you for coming. We have also our colleagues from NGOs, civil society organizations. I see Simon from AFNET. It's so important to have African CSOs involved on what we are doing. I can't recognize all of you colleagues because maybe I'm blind and I don't see all of you, but what is important is to say we have academia, we have AUC, the African Union Commission. All of us, we came together today with a number of partners to listen, to discuss, and to agree. Listen, discuss, and agree. We had to listen, Professor Samuel. Professor, it was so wonderful listening from you. You have to give us the power of data. Data is speaking. Dengue, 85% of increase in 10 years. 85%. And I told you, my sister Commissioner Minata, who's leading the health and humanitarian action in African Commission, she's sick, she has dengue. She's one of the victims of dengue. Antimicrobial resistance. I was attending a meeting in May in Europe, in Copenhagen. I was so shocked to be informed that there is a number of people dying, almost around 200 people dying per day in Europe. This is more than HIV, TB, and flu together in Europe. And you know, it's based on this kind of data that EU experts convinced leaders to bring money and support to fight MAR. I think in Africa we need more data. And we are informed. Who has again doubt that the next pandemic will be a zoonotic one? Professor Samuel has to show us that 75% of new diseases in Africa are zoonotic, worsened by the climate change. From this meeting, all of us, we know that climate change is affecting our well-being, is affecting our health, is affecting our health sector. Now, after listening, we discussed. Dr. Ahmed came with some recommendations supported by our two sisters, what we need to do. And I think we are agreeing on something after these 2 days, One Health approach. This One Health approach must be implemented. We don't say we have to think about it, we say it must be implemented. Because One Health approach is bringing the human being, the animal sector, and the environment. Last week I was in Botswana. I was meeting President Masisi and discussing with his government. How many of us know that Botswana is one of the leaders to manufacture vaccines for animals? We have some success in Africa. We need to celebrate success in Africa. And bringing the One Health approach is what will help us to build sustainable and resilient health systems in Africa towards a better response to the next pandemic. With that, Africa CDC is committing today to champion this One Health approach in Africa. We commit to all of you to work with our partners, to work with academia, to work with our member states to make One Health approach a reality in Africa. Let me now express my gratitude to all of you colleagues, every participant, speaker, organizer, my colleagues from Africa CDC for making this event not only a wonderful event, but an event that is helping us now to move forward with this agenda. I committed to President Ruto. I also committed to President Ramaphosa, who want to support the agenda of PPPI in Africa, that who are committed to implement the One Health approach. I will go back to them to say all African and friends of Africa who attended this meeting agree that One Health approach is what we have to implement. Not tomorrow, starting from today, and we need, as Dr. Ahmed said, to have a comprehensive approach on how to implement that. With these few words, colleagues, without reading the wonderful speech that they developed for me, I thank all of you for attending, and I wish you a wonderful afternoon.
Thank you very much for that session. Sorry friends for being a bit late for the next session, but we're starting right away. The other session is on advancing locally led adaptation in Africa. And so those who would like to attend that session, please be in. May I have my brother Obed here and the other speakers for this session, please come forward. Where is she? Okay. Oh, she's moderating. Okay, that's fantastic. She can lead us. You have some slides? No, we don't have slides. Okay. That is even much better. We have questions, technical questions to each speaker. Okay. Please settle down for the next session. If you are attending the next session, thank you.